Hi, Dr. Tracy Tyson. I'm a board certified general pediatrician, and let's talk about self-care. So every time I do a new assessment with a person who is struggling with their mental health and we start talking about ways for them to be able to get some improvement, the first things that we talk about is self-care. And this doesn't go over very well with most people, and I understand why. But let's talk about why this is so important. What does the evidence show, and what can you actually get out of it? So often individuals, when they are struggling with their mental health, they're literally just digging themselves out of quicksand. And every time they try to dig themselves out, more quicksand just comes down on them. So when you start talking to them about pulling themselves out of it, it feels really disrespectful. But that's actually not what self-care is. Self-care, when it is guided by either a layperson, but especially by a licensed mental health counselor, is one of the most beneficial things that you can do for your mental health. It actually has a ton of evidence behind it. So here's what we mean. If you are struggling with anxiety, you're going to also start struggling with basic care of yourself, and you are going to not promote your physical health as much, or maybe your sleep, or maybe your nutritional health, or maybe prioritizing relationships. So self-care is finding out what are the things that make you feel the most grounded or the most important for you. If you don't know, then we trial out what we know science already shows, and we put them in a homework format. So this week, I know you're struggling, but this week, I want you to walk for 5 minutes every single day. I want you to decrease your screen time by 20 minutes, and I want you to shower every day. And sometimes that's it. And then you write down how that felt every day, and did you do it? And then you follow up with the therapist. Okay, how did it feel? It was a little bit better. So then we up it a notch, and we take it up, and we increase the physical activity, and we increase the body self-care, and we sit down and have a meal with a person instead of just snacking or not eating at all in some cases, or we make sure we make a coffee date with a friend, or we make sure that we do something nice for ourselves, like change our sheets every Sunday night so we start Monday off in a better place. These things sound really silly and like they won't help, but when they're done in conjunction as a homework assignment, studies show that this can decrease your significance to your mental health by almost half. So again, it's not just about taking the walk. It's not just about the self-care of skincare. It's about prioritizing yourself as a person and trying to get dopamine and excess happy chemicals from other places in a small moving forward way. So I hope this helps you understand a little bit why we recommend it. So often I know that we all of us push back whenever mental health counseling is suggested, right? Because we're struggling so much, we just don't think we can take anything else on. But if you have a really good licensed mental health therapist, they will understand how deep underwater you are, and they will give you small homework assignments each week to try to pull you out from underneath the depths. It's like having a life preserver, and you're just grabbing onto it and they're helping pull you out. You do have to do the work, but you can do it slow and easy and let it build on itself. So don't negate self-care. Don't negate talking to a mental therapist. Don't feel like it's not going to help. Studies show it does, and it's going to make the biggest difference long-term for your mental health. Take care.